round of applause our first speaker for the session, Dr. Jeedhu Radhakrishnan, Assistant Professor, Department of Emergency Medicine, KMC Manipal.
I'm sorry, there's a small correction in here. I don't work for KMC Manipal, I work for KMC Mangalore. I'm not an assistant professor anymore. Hope I was that young, you know. So I work for KMC Mangalore, basically as a consultant head of Department of Emergency Medicine. I take care of Goa, Mangalore and Kerala units. Right, moving on. So my topic for today probably supposed to be, you know, something like new innovations in emergency. Since I have a flight somewhere at 4 o'clock, I have to finish it off fast, so it's been preponed. So we'll talk about the satellite emergency centers. Thank you, Haider sir, for having me here. When I spoke to Haider sir regarding this topic, this is what I want to talk about. It was misunderstood that I'm going to talk about the satellites, you know, the space, you know, satellite emergency centers. I'll correct again, it is nothing to do with the space. We are still here, grounded, yeah? Okay. Now, looking at this picture, what we see here is, you know, an ambulance stuck in, you know, traffic. This is a regular routine what we see in our, you know, cities. What comes to our mind that yes, the ambulance stuck in the traffic, this is going to delay in reaching the hospital. But just think, this ambulance has to travel all the way around 40-50 kilometers or sometimes 100 kilometers to reach your definitive care. Yeah, just think about the apprehension of people sitting inside the ambulance. A mother holding a child with, you know, having a febrile seizures or running high temperature. A person who's, you know, acutely bleeding in there. They are very apprehensive and most of them die on the way. And this state, we have, you know, pilgrimage around here, you know, Kedarnath. What happens here is we have a footfall of sometimes more than 36,000 people visit here. Which is situated around 14,000 feet around the sea level, above the sea level. What happens if there's an emergency? Now, according to the data, what it says, you know, this little old, every 10 kilometers travel in an ambulance, the mortality rate, this is for trauma related, the mortality rate goes up above by 1%, every 10 kilometers. Now, this is for the trauma related. Now, when it comes to asthma or cardiac related, the percentage goes high as 10% high in the mortality rate. That means every 10 kilometers, your 10% mortality rate goes high. Now, this is a statistics which is there having, you know, in Karnataka, which says that more than 90,000 people don't receive an ambulance, you know, or delay in ambulance, or in this, more than 6,000 people, you know, ambulance dispatch time is delayed by more than 30 minutes. This is again, it's combined of rural and urban areas. Now, what are the problems we have right now here? In the pre-hospital care, at the site of the impact, we have a problem. At the transit, we have a problem. At the hospital also, we have a problem. At the site of impact, what is the problem? We don't have first responders. We don't have proper first aid training. We are confused what the number we should call. It's 108 or 102, 101. They're really confused what to call. At the transit, what happens? The ambulance are not equipped, and the EMTs, the standard is being compromised. It's not standardized. You know, that's the main problem there. At the healthcare, again, in most of us are placed here in the, you know, in the cities. But what happens in the rural area? There's no proper emergency care in there. So the WHO, what they say is in 2005, what they brought to notice that in low, you know, economic countries, if we strengthen the pre-hospital care, your mortality rate can be improved by 50%. That's a very big number. 50% improvement if you improve the pre-hospital care. The director of WHO also told that, okay, no one should be deprived of an emergency care. All should be given, you know, of an emergency care. Now we have a problem in India. In India, what is the problem? We have a problem with the pre-hospital care. We have a health insurance issues, universal health insurance issues, and we have availability of resources in the right place and distance of travel to the definitive care. So Indian ambulance, you know, I'll just run through the history of Indian ambulance. We don't have much time on it. 1990s, you know, 80s, 90s, we had the first, you know, private ambulance which came in. Mainly it was transporting from one hospital to other hospital, and then mainly played by the private, you know, hospitals. and it's very expensive. Then what happens? The NGOs came in to help this guys, and then they told that okay, we will support the pre-hospital care by providing ambulance. The question happens, who's going to man the ambulance there? And all the NGOs had different numbers. So people again lost trust in there and didn't know whom to call and when to call.